an OG Kush, right? Energy in so before long, we look at these strains in the lab, and we find that, you know, somebody says, oh, this is initially a Kush, it's got to be a couch lock. We see no myrcene, and we see it's very energetic when people smoke it. So if you're looking for the difference pharmaceutically between energy and a relaxed sensation for bedtime or something, you need to know the myrcene content. If it's 0.5% or more, it's gravitating towards couch lock. Less than 0.4%, it's still energetic. Okay, this is Doug's Varin. This is the latest, craziest thing out here we've seen. It's very rare. There's only one source of it present. We're working on getting it out. It'll take about a year. By the way, we're one of the folks that got out the AC/DC. I was frustrated there wasn't enough high CBD out there, so 2 years ago I got together with some very close horticulturist friends and said, what can we do about this? I want to flood the market for free with tons of clones. And 2 years ago, because there was no such thing as CBD hardly, we flooded the market with 200 clones of AC/DC, all through California and another state, can't mention specifically, that would get me in trouble, but and now I'm seeing AC/DC in pill form, I'm seeing it in concentrate form, I'm seeing it in edibles. It's wonderful. We hope to do the same thing with Doug's Varin. Now, what's unique about Doug's Varin? Well, it has a large amount of THCV, the acid form, or THC, okay? And what's important about that is that this particular cannabinoid, which is closely related to THC, increases the psychoactivity of THC. That's good for some people, not good for others. It's much, much more energetic than any sativa, if you will, or energetic THC that you've ever seen. But more importantly, it suppresses fight-flight syndrome, right? So for PTSD, if you can't panic, you can't go off, right? And so the Israelis have been brilliant at looking at this particular strain and developing strains. These strains originally come from Africa. Normally, the plant will have a whole lot of THCA that'll form THC, and only 0.5% of the THCVA. Okay, so the Varin only 0.5%. This particular strain already has almost equal amounts of both. This is the keef from it. It doesn't have to be the flower. It's a little higher concentration, but you see nearly a 1-to-1 ratio with 19% THCA and 15% THCV. You also notice there's lots of myrcene in here, 1.5%. You say, ooh, that must be really couch locky. Not when THCV is around. When THCV is around, there is no couch locky, and there's not going to be a couch lock. Okay, so it actually flips that back again, or protects the energy effect of the THC. We don't know how that does that yet, but that's pretty intriguing. Anyway, so I use this a lot for my combat vets and myself. It's also good for Parkinson's. We've discovered that with CBD, although it's good for a lot of seizure and tremor type disorders, it doesn't work very well in Parkinson's. It probably doesn't work very well on ALS either, because those both follow sort of the same model, which is different than, say, epilepsy. Okay? And so, we don't know yet, but it could have effect, yes. Yeah, I got to go through, save your question, when we get the question answered, we'll go through that, okay? Thank you, but it's a good question. It's a very good question. So, what we find, though, is with Parkinson's things, it not only takes care of the tremors and seizures, but we're starting to see evidence that it actually starts stopping the growth of the lesions on the brain, or even to some extent lessens them, shrinks them. Now, the problem is, at present, there's probably 20 people across the planet who have had enough THCV to even use. That's how little there is. I'm lucky to be one of them, okay? So we're hoping in the next couple of years to get this out. We're working on that right now. Anyway, so here's an example. Also, it has alpha-pinene. Let me tell you a little bit about alpha-pinene. We know a lot of cannabinoids are bronchial dilators, and other terpenes are too. But alpha-pinene is king for that. If you really want to, if you have a problem where you need to open up the lungs, get them to expand, just by breathing alpha-pinene, in the classic days it was done through aromatherapy, okay? So we end up breathing in the alpha-pinene, it expands and increases lung function, by creating greater surface area, by creating bronchial dilation, creating greater surface area, you get greater absorption from the lung partition into the bloodstream. So again, having alpha-pinene, for instance, in an inhalant, some kind of inhalation therapy, regardless of if it's for the upper respiratory tract or the lower respiratory tract, is an important additive that you would put in the entourage. You consider it part of the delivery vehicle, if you will. Okay. Another one we have here, of course, is limonene. What's important about limonene? Well, limonene, it doesn't like fungus. If you got toenail fungus, you know, in the old days when I was a hospital corps, we had to remove the nail to treat it because you couldn't get through the nail. But what do we know about limonene? We normally call it citrus cleaner. It's great at removing grease. It's because it absorbs into tissue and protein really well. Okay? So you can put that directly on top of the toenail. It'll absorb through and kill the fungus underneath. Okay? Limonene is good for depression. It's used usually about 1/2 gram 3 times a day. It comes in capsule form for that. A more important use that I like for making topicals is because it's a good degreaser, it's not only a good penetrant to get into tissue, including tumors, including skin, but it takes other chemicals with it. And so a really simple test you can do is say I use almost exclusively olive oil as the base for my topicals. If you take olive oil, you rub it into the back of your hand in a dry spot, has to be dry, and figure out how long it takes for it to totally absorb into the body or into the skin so none of it wipes off. It takes a little while. Put in 10% limonene in that carrier base of olive oil, rub it for 20 seconds, it's completely in. If you have other chemicals, like I usually make a mixture of cannabis essential oil, lemongrass, and chamomile essential oil. All of it goes in the skin. It just takes 15 to 20 seconds of rubbing. It's entirely in the system. You can't rub it. There's nothing left on the surface. Now, on the other hand, I see a lot of poorly made topicals out there because we test them. And, you know, this stuff's like a grease slick on the skin. Well, if it forms a grease slick on the skin, it's not going anywhere. It's not absorbing, right? So limonene is absolutely brilliant at getting things to absorb into tissue. The other thing I would tell you about limonene is it also doesn't like cancer. It's very aggressive on cancer, the same way cannabinoids are. And so if you were treating a cancerous tumor in the stomach where you had physical contact with it from a drug, you could use limonene to bathe that thing in, which doesn't harm the person. And if you had a limonene cannabinoid hops oil mix, you'd have a lot of aggressive cancer-fighting compounds all being helped by that limonene to get it into the tissue, the same way that you can absorb it into the tissue of the skin. Next slide, please. I gotta hurry up. So this is Harlequin. Harlequin has about 2 parts THC to 1 part CBD. Okay? And so what you find entourage or mixture-wise is we know that there are certain times when having close to a 1-to-1 ratio is better than either or. For pain, that's important. For tumors, that's important from what we see with research. Last slide, please. Okay, so these are 6 different strains, Super Silver Haze, Granddaddy Purple. Notice that the Blue Dream is sitting there at 1.2% Mercy, large number. Notice the other one you expect, Fire OG, is sitting there at about 0.9%, almost 1%. Notice on the other hand, the energetic strains like THC have very, very little, 0.4. Sour Diesel has 0.4. Okay, Trainwreck only has 0.2. Okay, so these are some of the terpenes. I know I'm out of time, right? Sorry, folks.
Thank you so much, Reverend Dr. Grimmie. And this wouldn't be possible without our sponsors, and I'd like to say thanks to magicalbutter.com and Harborside Center. So this time we're going to take a break, and we'll continue on with Martin Lead if we got his slides up. Thank you.
Magical butter, magical butter, magical butter, magical butter, magical butter. It's magical butter. If you got a little oil and herb around the house, just mix it up, just mix it up. If you got a little butter and herb around the house, just mix it up, just mix it up. If you don't know what to do with them all, just put them in and just mix it up, just mix it up. Don't chop it up, don't roll it up, just mix it up, just mix it up. I got butter over here and herbs over there. Magical butter. It's magical butter. I got oils over here and herbs over there. Magical butter. It's magical butter. For my cookies and my snacks and my brownies, oh yeah. Magical butter. It's magical butter. I got that magical butter. Magical butter. Magical butter. Magical butter. I said we don't stop when it's time to rock. We put the oils on top and watch the party pop. Pour it on a salad, pour it on a steak. Maybe for your oils, maybe for a shake.
Welcome back, everyone, to Awaken America. We're going to be continuing hearing from Martin Lee. So, floor is yours.
Thank you very much. I'm going to present a series of slides that most of them are just simply science abstracts, summations of scientific research focusing particularly on CBD cannabidiol. I'm going to do this very quickly. Ordinarily, I could dwell on the slides quite a bit. Just to start off, the first slide is from a Brazilian study, Brazilian scientists. The title of the abstract is Safety and Side Effects of CBD, a cannabis sativa constituent, and in the article it concludes, chronic use in high doses are well tolerated in humans. Just to set that first. Now I want to go to the next slide regarding CBD's anti-tumoral effects. This is from the California Pacific Medical Center in San Francisco, has done research on CBD and THC and cancer, and the abstract title, the article title reads, Pathways mediating the effects of CBD on the reduction of breast cancer cell proliferation, invasion, and metastasis. That's from 2010. Also, next slide, from the same research institute. The title of the abstract, CBD enhances the inhibitory effects of THC on human glioblastoma cell proliferation and survival. In other words, THC is found to inhibit brain cancer. CBD, when combined with THC, has a more potent anti-tumoral effect. For breast cancer, they found something similar. CBD, powerful against breast cancer in and of itself, as the previous document showed. THC also has strong anti-tumoral effects with respect to breast cancer, but when combined, they have a more potent effect. Let's look at the next slide. And this is one I think that will be dear to everybody's heart here. This is from Seizure Magazine, 2011. CBD exerts anticonvulsant effects in animal models of temporal lobe and partial seizures. What they do, the scientists, they create animal models of diseases. They can induce a seizure or a seizure syndrome in an animal. They administer CBD before, and they find that it mitigates the seizures. Well, we know that it actually works on children and humans. But this, again, is the preclinical work. And what's very powerful about this, we can show the next slide, is that the preclinical research now that's been going on for really ever since the endocannabinoid system was discovered in the late 80s, or began to be discovered, the discovery stretched over a number of years, the preclinical research powerfully validates the experience of many medical marijuana patients. The next slide. Again, the abstract reads, the non-psychoactive cannabis constituent cannabidiol is an orally effective therapeutic agent in rat chronic inflammatory and neuropathic pain. We know also from clinical trials conducted by GW Pharmaceuticals for their product Sativex, a one-to-one mixture of CBD and THC, and under-the-tongue spray. It's been approved for use in over 20 countries for neuropathic pain. That's a very difficult condition to treat. Opiates really don't touch that. It's a different kind of pain than what an opiate would be effective for. Neuropathic pain, cancer patients experience that, AIDS patients, rheumatism, multiple sclerosis. It's pain from damaged nerves in the periphery. And THC dominant strains are very effective for that because THC binds to the peripheral cannabinoid receptor, the CB2 receptor. CB1 is mainly in the brain and the central nervous system. CB2 mainly in the peripheral nervous system and the peripheral organs. THC binds to both. When it binds to the CB2 receptor, it reduces inflammation and pain. But when CBD is part of that, when you have a CBD-rich strain with THC and CBD, CBD has other effects that modulate pain, binding to other receptors in the body. So when the two are together again, it has an enhanced effect. It's that synergy, the entourage that we're referring to. So good for neuropathic pain. Next slide. CBD and diabetes. This is from a study in Israel, 2006. CBD lowers incidence of diabetes in non-obese diabetic mice. They found they would create an animal model of diabetes. They'd administer CBD either before, during, or after, and they find it lowered the incidence of diabetes. Next slide. This is from the British Journal of Pharmacology, 2010, a very preeminent scientific journal. And the title of the abstract, acute administration of CBD in vivo and in live animal suppresses ischemia-induced cardiac arrhythmias and reduces infarct size when given at reperfusion. What that means, they induce a stroke in an animal, but when CBD is administered before the stroke is induced, it reduces the size of the stroke, and it also suppresses heart arrhythmia. Now, heart arrhythmia is a very prevalent condition in our society as people age. CBD suppresses heart arrhythmia. And this was also discussed at a recent paper just a few weeks ago in Italy, new information about CBD suppressing heart arrhythmia. Did you think of the previous two slides? Diabetes and cardiovascular disease. These are two of the most, metabolic syndrome in general, including diabetes. This is two of the most prevalent conditions in our society. And CBD shows great promise for those conditions. Next slide. Just a few more. We're going to keep going quickly. CBD as an antipsychotic, also research done in Brazil, since repeated in Germany, and now there's clinical trials actually being conducted at Yale University using pure synthetic CBD on schizophrenics, human subjects, to determine whether that they can confirm the earlier studies that shows that CBD has a powerful antipsychotic effect. Next slide. I think this is an underappreciated area for cannabinoids. Not just CBD, but several cannabinoids were tested for their antibiotic effects. And this study published by the American Chemical Society, you can't get any more mainstream than that, in 2008, concluded that CBD showed potent activity against a variety of methicillin-resistant staph strains. That's MRSA. You know, we have the World Health Association has identified as one of the major looming health crises of the 21st century is antibiotic-resistant bacteria. We've used so much antibiotics that the bacteria always outsmart us. CBD nails it. And actually THC does as well, and several other cannabinoids. Again, a very important area. Next slide. This is from the famous patent that has been issued. I'll just read it. Cannabinoids have been found to have antioxidant properties and are found to have particular application as neuroprotectants, for example, in limiting neurological damage following ischemic insults such as a stroke and trauma, or in the treatment of neurodegenerative diseases such as Alzheimer's disease, Parkinson's disease, and HIV dementia. And this is a study looking at both CBD and THC. Next slide. The CBD as a neuroprotectant. This is, I think, one of my favorites from the Journal of Neuroscience from September 2007, a French study. And in the title of the study, non-psychoactive CBD prevents prion accumulation and protects neurons against prion toxicity. Prion is mad cow disease. That's an infectious neurological disorder. You know, Alzheimer's is a neurological disorder, but you can't give it to somebody. Mad cow is transferable. It's very dangerous. It's also called Jacob-Creutzfeldt syndrome, and it's on the increase in our society. From this French study, it states CBD may protect neurons against the multiple molecular and cellular factors involved in the different steps of the neurodegenerative process which takes place during prion infection. CBD could be a cure for mad cow. I mean, that's another jaw dropper. Last slide that we're going to look at in terms of abstracts, and this is about CBD's neurogenic properties, meaning CBD not only is neuroprotective, protects against cell degeneration, but it also promotes the new cell growth. And in this particular study, it refers to how CBD promotes stem cell creation and neurogenesis, the creation of new nerve cells and brain cells, and it refers explicitly to the pro-neurogenic effects of CBD. So clearly we're dealing with a remarkable compound here that has potential for many, many different conditions. That's what's so astonishing. I mean, it's astonishing enough just if it only does what it does for seizure disorders, great, it's almost like a miracle. But we're talking about quite a broad range here. It clearly connects with something very profound in terms of human health. Last two slides will just show you this for Project CBD. We have a booth set up in the back. There's some literature if you'd like. And you can go to the website, projectcbd.org, where I've just pulled a few conditions to talk about. There's 50 different conditions listed on the website with lots of science. You click onto a particular condition, whether it's acne or depression or sleep disorders, and it will bring up a whole host of different abstracts that you can look at and as a resource that we provide. Last slide. Some of this is discussed in Smoke Signals, my book. I think we also have copies there if anybody's interested. Happy to sign it. I don't know if I've taken up my allotted time. If I had a few minutes more, I would just sum it up this way. You know, most of what we've heard about here, again, are based on animal studies. Scientists find that when they gather data based on animal studies, well, oftentimes it's a good clue for what might apply for people. It doesn't always transfer that way. It doesn't always transpose. And it's particularly problematic when people read a science report and they say, gee, this rat was given X amount of CBD, and this rat weighed, let's say, 1 pound, and it was given a certain amount of CBD, and it controlled or mitigated diabetes. Well, for a 150-pound person, you just give 150 times the amount, and it will do the same thing. There's a logical leap there that is unwarranted. And what we are on the cusp of, I think, that's very exciting in the medical marijuana community, now that we have the cannabis oil concentrates, some of them are CBD rich or CBD dominant, like the Charlotte's Web or the ACDC, or GW's Epidiolex, which has no THC at all. But we have now a range of different strains that are CBD rich. Some of them have a 1-to-1 ratio. Some, like a Harlequin, you might find 2-to-1 CBD to THC, or a whole host of ratios. And by extracting the cannabis oil, one can create different ratios. And these are now coming on the market, very high quality oils. One of them, which I'm very excited about, is the Care by Design line that's just being introduced. There's a series of different ratios. And it's incumbent upon patients and doctors that we have to, in a sense, discover what the correct ratio for our condition, the correct dosage. It doesn't work simplistically like, you know, take 2 of these and just call me in the morning. For a person who's uncomfortable with THC, you wouldn't start them on a ratio that has a lot of THC in it. Maybe even you wouldn't start them on an equal amount. Maybe you'd pick a strain that was very little THC. Maybe if it was a newcomer, a senior, or a child, you'd start them off that way, then gradually increase the ratio or the amount of THC until you find that sweet spot that seems to work best. So in this great laboratory experiment of democracy known as the medical marijuana phenomenon, warts and all, we have a great opportunity to do something that's really never been done before. And it's the patients who are teaching the doctors and telling the doctors what are working. The doctors are more guides than prescribers, per se. And that's very, very exciting. It's great to be a part of that. I invite you to, again, visit the literature that we have at the table there. And thank you for listening.
Thank you so much. Look forward to hearing some of the questions our audience and viewers at home have to ask. We're just going to roll this right along to Mark Gordon.
First of all, I'm very grateful to be here. Thank you. It's my second trip to Modesto. The first was to see Leon Russell. So I came to cannabis completely thinking with every prejudice that anybody could possibly have. It's for drug addicts. It's for stoners. It's for all the above. Fortunately, the events of my life, which took me from caring for a first husband at 20 years old who died of cancer, and we went an integrative route back in 1979, through to being the primary caregiver and working with hospice off and on for 17 years, and then becoming a patient myself. At one point, I had injured myself and been on 26 medications. Many of those were very common to you all. You've heard of fentanyl patch, Neurontin, methadones, steroids of different things, on and on. One time we took the PDR out and we took a look at the 26 pharmaceuticals, and we did we diagrammed it to see how many of them were causing the effects of other drugs that I was having to take. And so once we realized this and I had that aha moment, I started dropping them off. The problem was I didn't have anything to fill the void, because I actually needed the initial ones. I needed the fentanyl and the Neurontin and those things. Well, I was fortunate enough to be introduced by a woman that I met traveling in Oregon, who was making pot brownies for her boyfriend, who was a long-haul truck driver. and had a serious neck injury at cervical spine, and she made him brownies, and he slept through the night every night. He didn't like cannabis. He ate one brownie, and I'm like, I got to know more about this. What's going on with this? This isn't using it like getting high and smoking and doing all the things like I pictured and had experience in a family that I came from of alcoholics and drug addicts. So I had all the prejudices. My husband needed to have surgery on his back, and he can't take opiates either. So we were looking for a solution for both of us. And I went to another state, and I was able to find something called Triple X Chem Dog. These names I was not prepared for. You know, the names of some of these strains. I know how the people were when they named them. Now I know how to understand some of the genetics, but I was like, you know, can't you just call it aspirin, you know, or something? But now I get it. Now I completely get it. And so I went and I looked on the internet and I researched, and I started finding that there were a lot of people giving a lot of different information and very little that was consistent. Very little that had been documented past somebody's own personal experience. And because things were not being tested at this point, particularly, there was all hearsay. Well, about this time, I found an article on terpenes and terpenoids that I have been using and referring